don't listen to research. Nowadays, research can be backed by many different sources, companies, the government, all with different motives. If someone is researching, then they themselves don't have the answer. There's so much research nowadays that people are researching researchers, and this just makes people confused. Researching researchers is like the blind following the blind. Most research is useless in healthcare, but I suppose it could be a hobby. You definitely want to take health advice from somebody who is doing more than just reading and has academic knowledge. You want to take advice from somebody who has actual experience and clinical experience, and hopefully for many years. If they don't have experience meeting patients day to day behind a desk for 10 years or more when it comes to health care, then I wouldn't read anything that they write or anything they have to say. And any research has very little value. If you want to think about it, if you want to fix your car, do you speak to somebody who just researched what other mechanics have to say, or speak to a seasoned, experienced mechanic who has a long history of car repair? If you were going to give birth to a child, would you read research about giving birth, or speak to somebody who has assisted in hundreds, if not thousands, of births and have had many children of their own? We all know that academic knowledge is nothing compared to real life experience. We all want to speak to a person with experience. So why are we reading this research? Why are we being pulled in by the research? Why are we believing it? When often the research we have today will be disproven tomorrow, like the research in the past has been disproven today. The research can say D1 is helpful, and then a few years later the research can say no, D1 is not a helpful supplement. It has carcinogenic side effects. So they come up with D2, and then the research says D2 is absorbable, but then research comes out and says that no, D2 does not absorb and help to absorb calcium in the bone, so they come up with D3. And they're already research disproving D3. So this is the life of a scientist. I believe that we have gone through the age of information where we've had unlimited information and everybody's had the opportunity to share their ideas and research and experience, of course, due to the internet and the availability of computers. However, this has led to what I call the age of confusion due to too much information. In reality, Google knows nothing. Research does not prove anything, and we don't even know who is behind the research and their motives. Only trust those who are real and have real experience for all aspects of advice in life. If you're going to have a child and you want to talk to a mother, if you want to fix your car, you want to talk to a seasoned mechanic. You're not looking at his books that he wrote or the research that he's reading. And this is particularly true with healthcare because it's very sophisticated, very complex, and no amount of reading and studying can help you compared with experience. For example, as a healthcare practitioner, I've always been weak in helping women with hormonal issues and for example, PMS. But because I cannot experience these symptoms, so I'm handicapped in understanding them, and I'm handicapped in treating them because I can't practice or treat myself and can't truly empathize with the patient. So it's only through my experience with patients, so for many years with women, and getting their feedback and them sharing their experience with me about different herbs, different herbal treatments, and the effects on them, and of course what other Ayurvedic doctors and herbalists have told me from their experience what worked. So even though I cannot experience the symptoms of menstruation, and I can still treat it, but not because of all my reading. All my reading and all my studying didn't help me at all. It was only through time learning from the patients themselves, from their experience. So you can learn from somebody else's experience, but reading it only goes so far. Maybe it prepares you to understand somebody's experience and be able to interpret it, but it doesn't help you to have a deep understanding of a subject just by reading it. Even if you're reading somebody else who knows, you have to have the experience in the end of the day. Seasoned herbalists and don't read research. We don't care if science has proven something or not. Science is always trying to prove things and coming to conclusions that are often proved incorrect in the future. Science, in fact, is slow to figure things out and often can't figure out many phenomena of the seen and unseen world. People say, well, if it's not proven, then it doesn't exist. Well, you can't prove love. You can't measure love. There's no meter that proves that it exists between a husband and a wife. But we know it's there. The wife knows it's there or not there. So, science is very limited. And it's not that helpful for helping practical problems like giving birth to a child or fixing your car or helping your improve a chronic health condition. You need some experience of somebody who's climbed the mountain before, who's treated that particular health condition over and over and has the experience and knows what to do, because there's often a lot of details and that would only be gained by experience. For example, conjunctivitis or inflammation or infection in the eye. You can read what herbs will help, mixing, say, triphala and coriander, or there's Western herbs like eyebright, and even it can be made into an infusion and used to clean the eye. And there's many herbs that are known to help with this type of eye infection. But until you've cleaned out somebody's eye 5 times a day, over and over, and then cleaned out those little glands and get that pus out of there real gently, and then rinsed it and moved the water around, and sterilized the water before you did it, and made sure you used cotton or that wasn't bleached to not hurt the eye, and until you've really had that experience of cleaning another person's eye over and over and over, and seeing the healing take place. I wouldn't recommend treating a serious eye infection without speaking to somebody with this level of experience, and preferably just rather have them do it, because even if they try to tell you from their experience, until you have the experience, you can't be good at it. So even if I have the experience in something and I try to tell you, until you've done it, until you've experienced, you're not an expert, or you don't have the knowledge. So we all know that experience is very important. As an herbalist, we know the actions and effects of certain herbs and formulas because we've seen them in results of our practice. So whether science can figure out whether an herb works or how it works or why it works, that's their job. It's not of concern to an herbalist or somebody who's trying to use herbs to treat their health condition. What we care about is results and whether it works or not. Herbology and the knowledge of herbs is an ancient knowledge and has been already proven by time. I'm talking about empirical knowledge, that which has been known because people have been doing it successfully for thousands of years. And we could call that wisdom. And we don't really need to prove it. We don't really need to have science prove it. If we know it works, if we've experienced it ourselves and it's worked, then who needs the science? The science is for scientists. But it doesn't mean that if there's no proof or science hasn't got to it yet, then it doesn't exist. There's thousands and thousands of herbs, and so far science has really only started with just a few, like turmeric and moringa and tulsi and amlaki, and Western herbs. They're just beginning to even start to research these herbs, not alone understand how they work and how they would work in combination as formulas, which is mostly how they're used. So that's why I never refer to research or modern scientific studies. I just and I never am using anything new or anything that's just been discovered or has new research on it. You can't be going by eating foods based on 5 foods that are high in vitamin D or 10 foods that are high in magnesium based on the research. Even the whole science of nutritional science is all just based on research of people in white lab coats and laboratories looking at things through a microscope and coming to conclusions that, well, there's more nutrients in this particular vegetable uncooked than cooked. So then everybody's coming to the conclusion from this research that it must be better to eat it uncooked, when maybe through history and time everybody's known it's easier to digest to just cook it. And that's what people have traditionally done. We can often see this for things like cabbage and the cabbage family and cruciferous. And historically they were always well cooked, make it easy to digest. But modern science says that it has more nutrients when it's not cooked. But that doesn't mean you just go start eating it just because modern science says that it has more nutrients when it's not cooked. I mean, maybe you can't digest it. Maybe it's not suitable for you. Maybe it's going to give you a lot of gas and bloating. And of course, science does slowly catch up. And in this case, they've learned that the cruciferous family has a lot of sulfur, and that sulfur is a colon irritant. But, ancient Ayurveda science knew this thousands of years ago, that the cruciferous family, cabbage, particularly raw, can be a big colon irritant. They didn't care why. This is a reality. It just irritates the colon, difficult for some types to digest, and is always better to be cooked. Simple. It's just the way people did it. From experience, ancient wisdom. Stick with that. Safer. I hope that helped you. Thank you very much for your